Now.
Hey everybody, welcome to the 2021 SAEM Jeopardy game. This game is sponsored by SAEM, the Sex and Gender and EM Interest Group, the Academy for Women in Academic Emergency Medicine, the Academy for Diversity and Inclusion. And I just want to give a great big shout out to everybody who's shown up to participate in this game. Ooh. So here are our teams tonight, the board of directors, Rams and Nerds. Here are the members of our team: Jim Holmes, Ali Raja, Michelle Lal. The Rams team is Wendy Sun, Nehal Niak, and Taylor Stavely. And the Nerds team is made up of Ken Milne, Deb Dirks, and Jeff Klein. To let you know how the game will be played, there will be a board of 30 questions. After I finish a question, the first team on the private Zoom chat that puts the first initial of their team on that will then have 10 seconds to discuss amongst themselves to get the correct answer. If they're unable to get the correct answer, the team that puts their initial on after the answer is completed will have a chance to do the follow-up for the points. If you get the questions right, you get points. If you choose to answer the question and you get it wrong, you lose points. I'd also like to give a special thanks to everybody who worked really hard behind the scenes. This is the 5th year we were doing the game, but this is clearly the first year we're doing it virtual. So thank you, Holly from SAEM. Thank you for my squad of reliable SAEM co-workers, Basma, Allison, Kinjal, Tracy, and Angela. So here are today's categories. In the news, male, female, genetics, research, treatments, and vaccine trivia. Ooh. Before we get started, we're going to just start with a very simple definition to ensure that we're all on the same page. Biological sex is a physiological variable, and for most of us, it is binary. It's made up of our chromosomal and our hormonal makeup. So most of us can be categorized into a male or female category. Gender, on the other hand, refers to a socio-cultural context. And gender, as we know, occurs along a spectrum, which is bookended by stereotypical man and stereotypical woman. I started on this journey. Those of us who we're on Zoom, baby. For those of us who have gone deep into this research, I think we started off with a clear vertical line down the middle, thinking that it would be so great if we could divide things into physiological differences based on biological sex or to gender, sociocultural issues. But the more you do this research and the more you drink this Kool-Aid, you will find that gender influences a lot of health outcomes, and that the gender influences our life begin before we're even born. Think of all the gender reveal projects. But the next step is actually looking at how sex and gender loop into each other, meaning that our biological sex often goes over into our gender, and then due to the environmental exposures, our infections, our toxins, loop back to how our genome gets expressed through epigenetics. And our epigenetics, which genes get turned on or off, are heavily influenced by our biological sex. So to start this, I'm going to quote David Page, who studies the Y chromosome. Until and unless we arrive at an appreciation of how male and females read their genomes differently, we will continue to be surprised every time we encounter a sex difference in diseases, incidence, severity, or response to therapy. So that's the context. May the games begin. Rams, you guys get the first question.
All right, so let's do vaccine trivia for 300, please.
This plant is used in Novavax as an adjuvant. I believe that nerds were the first to answer that. You have 10 seconds to discuss amongst yourself and come up with the answer.
What is hydroxychloroquine? What? That's not right?
They're starting off negative. Is that even allowed?
This is gonna be.
Don't bring me down. Ivermectin? No. Vitamin D? No.
You know what a plant is?
Would anybody else like to try? Rams, would you like to? Which plant in this Novavax is used as an adjuvant?
Oh, why don't you do the honors?
Is it the soap bark tree?
It is.
They fucking Googled it.
There is a no Googling rule, right?
I'm not Googling it. Heard that one.
So this is a great quote from an immunologist. Adjuvants are the immunologist's dirty little secret. What an adjuvant does is make a vaccine actually work. And surprise, surprise, there are sex differences in adjuvant responses. In this Shingrix vaccine, there's a much higher adverse reaction in females compared to men. And selective adjuvants are used in vaccine development to enhance the male antibody response. Just as a bit of trivia, not on the board, there have been previous studies that say women getting half the dose of the flu vaccine probably get the same antibody response as males to a whole dose, which may become important when we have a vaccine that there's not enough of to give global supplies to. All right. Rams, I believe you got that right. Am I right?
Yes, we did. Since we're on a roll, why don't we do 400 vaccine trivia?
Jeanette, is there negative marking?
Yes.
So minus 300 and plus 300.
Exactly.
Okay.
In 1967, this popular comic strip devoted an entire week to the importance of measles vaccinations.
Hey, if you know the answer, can you say it?
No, you have to put it in the chat. So Rams, you again have the first chance at this.
What is peanuts?
Penis?
You are right.
I don't think they're old enough to know what the Peanuts cartoon is.
I think it's been regenerated multiple generations.
We know peanuts.
So what they learned from the Peanuts cartoon and through the public health vaccination attempts during the measles epidemic is that unfortunately measles eradication failed because diversity was ignored in messaging. Vaccines often went to private offices, so children going to public health clinics often didn't get them, and the funding for messaging evaporated too soon. Rams, you have the board.
Let's do 500 for vaccine trivia.
So I would suggest if people look up the references for any of these, and the references will go in the chat on YouTube, but they will also be attached in a formal document in the YouTube comments section so people can go back later and read some of these. I would really suggest people reading some of this material because it's stuff I had never heard of before. The International BRACE trial is evaluating the effectiveness of preventing severity of COVID-19 infections by administration of this to 10,000 healthcare workers. I believe that the board of directors got the first.
Why just
So we're allowed to talk for a second, but this is the one that's doing like BCG or something, right?
Yes.
Yeah. We're talking amongst ourselves. What if I was wrong?
No, you're correct.
Well, Jim says I'm correct, so I think that's our guess.
What is BCG?
You are correct. So BCG does this thing called trained immunity. And for those of us who never really heard about this before, you have to understand that there are vaccine-associated, quote, non-specific effects. Importantly, vaccines can either enhance or dampen response to infections from other organisms that they were not even meant to do anything for. However, whether you get a trained immunity depends on the type of the vaccine. And to let you know that this isn't just like a little thing, this can affect mortality. So live attenuated vaccines like BCG and the measles can actually reduce all-cause mortality, especially in developing countries where they have lots of infections and very poor medical systems. Importantly, however, it can also increase mortality in infants who receive the DPT after the live vaccine. And there's also a signal that this can do it with a malaria vaccine. Importantly, these swings of either helping your overall immunity or dampening are much greater in females. This is a quote from the Optum Immunized Consortium, and to let people know, these are not anti-vaxxers. These are people who study immunology and vaccines. The effects are not trivial. Data indicate that on the scale of Africa, hundreds of thousands of females per year may die owing to the negative NSE effects of non-live vaccines. And this may be as easy as changing the order in which vaccines are given. So it depends on the type of the vaccine, when they got the vaccine, and then the sex and the age of the patient. Going back to BCG vaccines, the idea is we can enhance healthcare workers' overall immunity and protect them possibly from severe COVID by ramping up their innate immune system. But to understand that everything is in such a delicate balance, if we ramp up the innate immune system, especially in middle-aged guys, we might also precipitate ACS. So there's a lot to learn that we still don't know. Okay, Board of Directors, you have the next question.
Jeanette, we had a request to go over the rules again.
Oh, the rules are, I finish the question, whoever answers first with their initial for their name gets the 10 seconds to talk with their team to be able to answer the question first. Any clarifications on those rules? All right, I think the Board of Directors has the board.
Go for it, Jim.
Research for 100.
This is the easiest question on the board. Listen carefully and get your little fingers ready. Underscoring the gaps in science. Currently, there are ongoing studies that block or supplement this male hormone in infected male patients. Rams.
All of the male emphasis, we've got to be talking about testosterone, right, Rams?
Brilliant.
So good.
So what is on the pro side of supplementing testosterone in severely ill COVID hospitalized patients? One, if you give testosterone, it's an anti-inflammatory and may suppress some of the maladaptive immune response. Two, a third of ICU patients admitted to for COVID actually appear to have low testosterone levels. And three, we know that COVID may actually suppress gonadal suppression and lower testosterone, the amount of testosterone in a male body. The con of giving testosterone is the second key, besides the ACE2 receptor, to get into the cells is this TMPRSS-associated protein, which is related to testosterone. Testosterone, as we'll talk about later, can also shift the RAS system. In addition, androgen blockers may decrease viral shedding and inflammatory markers. So I put this out there just to show how much there are huge gaps in basic science that we can't figure out whether we should be giving this hormone or should be taking it away to help people survive. Rams, you have the board.
Let's do research for 2.
A meta-analysis of 30 clinical trials on COVID treatments through June 2020 showed this many within 5 analyzed their data for potential sex differences. 30 trials, how many disaggregated their data?
And nerds go.
0.
Basma, who was it?
Nerds.
All right,
0.
that is within 5. 1 out of 30. Let's just let that sink in. Of all those early trials, 1 disaggregated their data by biological sex. This is 2,500 registered clinical data. This is a pre-Medrex study. Less than 5 put in their clinicaltrials.gov application that they intended to do sex disaggregated analysis of their data. So this clearly is not on the mind or radar of many of our medical researchers. So the question is, how do we know something's going to help, be better, or be worse for one biological sex if we never even think about asking the question in the first place? Here are resources for researchers to help include biological sex as a variable in their own research. All right, that was nerds. You got the board.
Research for 500.
In 2016, the NIH required that basic scientists doing animal research do this. You know, Basma, if it's okay with you, I'm going to ask you to start calling out who goes first.
Sure. Rams.
They have to include male and female animals.
You are correct. To get NIH funding, you have.
No, it's not true. They have to justify not using females.
That you have to. I think technically, Jeff is correct. You have to include both, or you have to give a reason why you are not including one. So this is a 2011 study of basic science research. Purple is good. It means that you included both male and female subjects in your basic research. If you look at the purple, the only basic science group that really did that in earnest was behavioral science. They repeated this analysis 10 years later, and now they found, yeah, a lot more purple, a lot more people including both male and female in their trials. However, they didn't tell how many male or females they actually included, and sex disaggregated analysis actually decreased. And why do we care about this in COVID? Well, pharmacology only had about a third of their studies, including both sexes, and immunology only analyzed their data by sex in less than a third of the time. I am not sure who's up. Who answered that last question?
We're saying Rams answered correctly.
All right, Rams, you're up again.
Let's do research for 3.
The recently released international inter-COVID study found significantly increased risk of COVID-related morbidity and mortality in patients with this, quote, temporary condition.
Nerds.
Pregnancy.
Excellent. COVID is not good if you are pregnant. It increases your risk of preeclampsia, eclampsia, severe infection, ICU admission, and neonatal complications. This is a great resource which Lauren Westerfer and Elizabeth Schoenfeld at our institute, UMass Bay State, put together to give women a shared decision-making document if they were pregnant as to the risk and benefits of giving a COVID vaccine. It is free. The link will be included in YouTube. I would really encourage everybody to use it. Nerds, you're up.
Genetics for 500.
It is estimated that approximately 14% of patients with severe COVID have autoantibodies against this type of cytokine, which may be hampering their initial immune response. Basma, are you going to pick that?
Yeah, Rams.
I remember reading about this in the paper. I think it might be TLR7.
That is a really good answer.
Or it could be interferon gamma. I don't remember. Is anybody, Nehal, do you want to split the divide? Hydroxychloroquine? I'm just kidding.
I think nerds are next.
Are we next?
Yeah.
So
Is it?
to be clear, before you give your answer, the answer that was not right was toll-like receptor 7.
Yeah. So talking amongst ourselves, Jeff, is this interleukin 6?
It begins with an I. And perhaps Rams might have actually mentioned it as their second choice.
It's an
Don't worry,
Ivermectin?
Rams. It's to your benefit that these guys are on your good side. You might need a job from them someday.
Jeff, did you hear? Because I was ignoring what they were saying.
Okay, we're used to it. We're residents.
It's an
Oh,
interleukin.
sorry, excuse me. What was that?
Exactly.
Now you want to hear.
They named toll-like receptor, which
TLR,
is TLR, which is not a cytokine. I think it's interleukin 12, but it's one of the interleukins.
Yeah, that's what it's one of the interleukins. I just didn't know what interferon.
It's one of the interleukins or
Exactly what I said. It's one of the interferons.
Yes, exactly.
Yeah, this Skype is breaking down.
So interestingly enough, 94% of these people who had this antibody were male, which is unusual because when we think of autoimmune, we usually think of that being something more likely to be an over-exuberant immune response that is more likely to happen in females. And one wonders if some of the effect on the convalescent serum is because this wasn't routinely tested in the antibody screening.
Interferon is an interleukin. It's interleukin 12.
Jeff, you're ahead of me in that, and I'm happy to give you the points for that. I'm not in a position to argue that. So having said that, we will give that to nerds. Nerds, you have the board.
Excellent. I think we need to go big or go home.
Ken, male or female for 500? Do you agree?
I don't like to dichotomize, but yes, male or female for 500.
This was written for Jeff. A 2020 meta-analysis of 28,000 hospitalized COVID patients suggested this sex was 1.5 times more likely than the opposite sex to get a COVID-related DVT in the hospital.
Nerds.
All right, Jeff, come on, help me out.
What is male?
What is males? What are males? What is a male?
Who is male? Why is male? Who? Why is Gamora? Sorry, that was maybe too obscure for you guys.
Possibly could. So I just want to quote this paper. Probably the only time research and practice in thrombosis and hemostasis has been quoted on a Jeopardy game. It may be important for patients who are taking testosterone supplements or for trans women who are on, supplements as far as increasing their risk of DVT, especially if we decide that giving testosterone may benefit mortality in COVID patients. All right, nerds, you have the
Yeah, look at that. Wow.
500.
Treatments for 500. All right.
Is it all?
And I guess actually, nerds, you get the first shot at this if you want it. Before we do that,
All right. How
much do the nerds have to be able to bet, Tracy?
We're all in. I don't care what Jeff says.
Okay, so I'll give us give a score update. I'll give a score update. We have 1,000 for Rams, 500 for the board of directors, 400 for nerds.
400.
We've got a bunch of 500 questions right.
Got a lot of negatives.
Yeah, but don't look at Jeff that way. He's trying. Don't be so negative.
He's crying?
He's not. Would you like to go for the full 400, nerds?
Oh, yeah.
All right, this is the question. This study evaluated the EMR in 5,451 COVID positive patients from a large English GP database. They found older women using this had a significantly lower all-cause COVID mortality rate.
Metamucil.
All right. Ken, I'd say estrogen. What do you think?
Estrogen.
Not Metamucil.
We will give you that.
The hormone replacement therapy.
So estrogen's kind of like your princess hormone. It really depends on the amount and the receptor. At low levels, it can be a pro-inflammatory. At high levels, it can be an anti-inflammatory. Importantly, the RAS system, which Basma, our judge, is an expert on, when we look at how hormones can influence which side of the system is emphasized, the inflammatory side or the anti-inflammatory side, hormones take into account for this, with the fulcrum being ACE2 inhibitors. So when we look at infections and immunology, we need to consider biological sex, hormones and chromosomes. We also need to include gender. What is the job somebody's doing? How is the infection spread? If you look at Ebola, women were much more affected because they were the people who were the healthcare workers, and they were the ones that were in close contact with the Ebola patients. And then we need to look at the effect of age, because age changes the immune response dramatically in both males and females.
So I would just like to say that that's an observational study. There could be a healthy volunteer bias with regards to that cohort that we're taking HRT.
Oh, obviously, this is definitely.
I completely agree, and so they just shouldn't get the question right.
Oh, I think we get double.
You do, actually.
For critically appraising that.
Thank you.
And because it was a daily double, but yes.
In the news for 500, please.
A 2020 Yale study evaluating microaggressions against medical students found the highest, 43%, were reported amongst this group. Basma, I don't know who was first. I think we lost our judge. Let's go. 758, 758.
Sorry, I was unmuted. Muted. I think it's nerds.
Oh, was I too aggressive on the N button?
Yeah, a little bit.
So I'm just going to read back the question because I wasn't paying attention. A 2020 Yale study evaluated microaggression against medical students and found the highest, 43%, were reported from among this group.
I'm going to go with what is women. What do you think, Ken?
I would go with what is females or women.
That is not the right answer. Would somebody else like to take a chance?
All right, what are minorities then?
The BOD would like to take a chance.
Okay, BOD, you have 10 seconds to huddle amongst yourself and answer.
I think it's LGBTQ plus.
Yep.
BOD. Are we good?
Totally.
What is LGBTQ plus?
Woo woo. And the thing they reported the highest was public humiliation.
I don't see any error bars on that. Are they statistically different? I mean, come on, that's a point estimate. What are the 95% confidence intervals say?
I will be happy to have a long discussion with you about that after the game is over, but thank you for bringing that attention. So
Subgroup analysis for women of color?
I just totally missed what you said, and we will move forward with this and come back to it. We're going to put it in the parking lot. Isn't that like what we're supposed to? We're going to put that in the parking lot. We'll come back later. So this is actually a super great reference to share with medical students, residents, and colleagues. It basically gives you things to say when you see something that you know in your heart is not okay, and you're not really sure what to do in the moment. So it goes through a bunch of phrases people can have in their back pocket to be allies. Because if we think that we're uncomfortable trying to step up, being the people who are the attendees in the powers position, imagine how awful it is for that student or that resident who has no power. All right, Michelle, your team is up.
Let's do male or female 400.
Early data suggests vaccine-induced thrombotic thrombocytopenia is more common in this sex.
Rams. After the question is completed.
Does that mean they don't get to answer it, Basma?
No, I jumped the gun.
Rams will answer because they actually put in after the question is completed.
What are we thinking, guys?
Well, we got a 50-50 shot here. I don't know. I'm going to guess women.
I agree.
No, guess men.
What are women?
What are females? So this came out of the J&J vaccine, and again, some more cases of cavernous venous thrombosis have come up since they put it back on the EAU. So if people are looking to get different vaccines, understanding with the J&J, it's probably about 1 in 150,000 are getting this VTE complication. It's most prominent in women under the age of 50, and at least with the J&J, I haven't seen the data on the AstraZeneca. There's no increase that's happening if the females are under control. All right, who's Rams? You have the board.
Let's do in the news for 400.
According to an April 2020 American Pew survey, a third of surveyed adults from this demographic feared someone might physically attack or threaten them, and 80% reported feeling that the risk of violence was increasing. Remember what happened in April 2021.
It was the board of directors.
Board of directors, would you like to answer?
Jim, you're on mute.
Yeah, I think we would like to answer. I think it's probably Asians.
Asian Americans.
Yeah.
Who are Asian Americans?
So the Asian American Pacific Islander website showed the incidence of harassment have skyrocketed over this past year, with verbal harassment, shunning, physical assault, spitting, and coughing on. I bring this up not only is important for our patients, but it's also important for our colleagues who are Asian American. They have had a particularly rough year. They're asked to step up and take care of COVID patients, and they are also a subject of often increasing rates of violence. So again, going back to the microaggressions, be an ally. If you see something, say something. These are resources to help our patients. Board of directors.
How about research for 400 to close it out?
Global 50/50 website started tracking this information early on in the pandemic.
What? I don't even know
Board
what
of
that is.
directors.
Are you done?
No.
Nihal, you can't answer for us.
Press the wrong button. And then R.
Michelle, does your team have an answer?
Jim or Ali, do we have an answer for this?
Technically, it wasn't us that chimed in. It was Nihal that chimed in for the board, which I'm pretty sure is against any kind of rule that this game has.
I don't want us to get negative points for this because I don't think any one of us knows.
Rams are winning
Still on
by.
the board for a few days.
All right, it's Rams.
So
Nihal,
Rams,
I
what
give
do
you
have
full
as the
responsibility for what happens right now.
Rams, what do you have as your answer?
Mortality. What is mortality breakdown by gender?
Yes, it's sex disaggregated death rates. So Global 50/50 has looked at 108 countries, and the death rates vary tremendously, but overall, there is a significant incidence of mortality in males from COVID than there are in females. The number they overall state is for every 10 females who die, 13 males die. There's an absolute 8% difference in the United States, but there's huge variation. And this gets back to the intersectionality. So it gets back to not only is biological sex a factor, but which men, which women, which non-binary individuals. And the last one, we have very little data on non-binary individuals. But I think this study from Harvard's Gender Sci Lab really underscores that there's a huge intersectionality in that. In this study, they showed that Black women in Michigan and in Georgia were much more likely to have a high mortality rate compared to white men. So it's not just enough to say there's a biological sex difference. We need to then go the next step and say in which populations who is getting sick. Rams, you have the board?
Let's do in the news for 300.
Oops. How about male, female for 300? Would that be okay?
Sounds good.
A 2019 study suggested that in patients intubated for acute respiratory distress, this sex were more likely to be placed in appropriate lung protective low volume settings.
Rams.
We have a text start going. Neil, I think you're right.
Okay, what is males?
Yes, you're correct. And the reason that is many times people are looking at weight instead of height. So short women were at increased risk for having tidal volumes that were greater than 8 cc's per kilo. So remember to using height and ideal body weight when you put somebody on a vent. Go ahead, Rams.
Let's do into the news for 300.
As oxygen saturation is often used to direct COVID treatments, a recent study suggesting less accuracy in pulse ox readings in this demographic is alarming.
There are too many. I think it was board of directors.
I think we go with Black patients, right?
Yeah, I'm good with that.
Yep.
What are Black patients? Who are? Where are?
Who are?
That's a good point. If I had asked you guys to do who are, you guys would have been the first people who scored any points.
We have to be winning now.
Yeah, I'm sure. Dark-skinned individuals. This is the data from that paper. It suggests that once your O2 sat gets to be about 90%, that it may overestimate it by about 2%. Unfortunately, this wasn't broken down by the type of pulse oximeters, and the next study is going to be which one of these, because they're made by different companies using slightly different technology. this isn't the only example where there's been indirect bias against dark-skinned individuals. There's some data to suggest that hand sensors and like bathroom airports don't pick up dark-skinned individuals. And University of Georgia did a study that said driverless cars had an increased risk of not recognizing dark-skinned individuals. This just underscores the importance, who's at the table, who's making questions, who has the power to figure out what gets funded, who has the power to design studies is really important. Board of directors.
Let's go with treatments for 400.
Oh, sorry, Jim. How about going with what I pressed?
That works too.
Thank you. I appreciate your flexibility. Nerds, you should notice that flexibility of the judge and the team. Approximately 15 to 23% of genes escape this cellular process in which genes from one of the female's 2 X chromosomes are turned off.
Rams.
Team, that's X inactivation, right?
Right. So Toll House receptor 7 comes back because this is one of the genes that doesn't undergo X inactivation. So what that suggests is that females who have 2 X chromosomes might actually have an overexpression compared to males of this Toll House receptor. And this is one of the receptors that, when it's stimulated, helps make interferon and helps with your initial innate immune response. Importantly, not just the genes on the X chromosome for ACE2 inhibitors or for toll-like receptor 7, there are genes on the X chromosomes that actually go and turn on and off which genes get expressed on other autosomes. Just as a reminder, to survive an infection, you have to have a strong innate response, an adaptive response with antibodies and T cells, and then you have to clean everything up. And importantly, you have to have perfect timing of all these different systems to be turned on and turned off. If you turn on too late, you might be overexpressing stuff. If you turn off too late, you might get autoimmune issues. And every single one of these has sex differences. There are hormonal receptors on most immune cells. There are chromosomal influences we just talked about. And then there are sex-specific epigenetics, which influence which genes get turned off and on the cell for the immune response. I'm not sure who has a board.
Let's do genetics for 3 if we haven't done that one already.
The gene for the ACE2 receptor is on what chromosome?
Rams, go for it.
Did Rams get it?
Yes.
I think it's the X. Do y'all agree?
So I put this study down. The computer software that actually allowed researchers to do better analysis for the X chromosome on these genomic-wide association studies, that didn't even come online to 2015. So much of this technology is really still pretty new. Rams?
Treatments for 4.
Early studies are suggesting getting a shot of this may help decrease long COVID symptoms, long haul COVID symptoms.
Rams again.
Is Google failing?
It's our text,
I don't hear any talking.
we have a text thread. We're rapid texters.
We are a text group.
We have a text
Is there 10 seconds over?
I want to say the answers again where you guys take credit.
So Rams, what?
Is it ours now?
I don't know. Rams, do you have an answer?
Nehal, go for it.
What is flu vaccine?
No.
No.
I think board of directors are up.
I think it's actually vaccinations, but it's COVID vaccination.
It's the COVID vaccine.
Yes. So again, this is a preprint study. It compared vaccinated to match unvaccinated patients. Long haul symptoms appeared to improve about a quarter of the vaccinated patients. So long haul COVID, that has many names. PASC is what Fauci likes to call it, which is post-acute COVID syndrome, I believe. We're not still 100% sure what causes it. There's several different theories: residual viral reservoir, a reaction to residual fragments of the virus, an autoimmune response, misplaced megakaryocytes in organs like the brain. And the last one I just read about last week, which was a totally different idea, is that because of this alteration of the immune response, that perhaps long haul COVID is due to the reawakening of other viruses, not even related to SARS-CoV-2. Importantly, anybody interested in research, there's going to be money to study long haul COVID. And the final thing I would say, this is kind of an interesting patient population to study, because a lot of the early movement of this came from online support groups who were just getting totally frustrated when they went to the physicians and they felt like they were getting medically gaslighted. And we've seen this with other sort of vague, like chronic fatigue syndrome or chronic EBV, that because we don't fully understand it, sometimes we discredit patients. I believe board of directors answered that.
Correct.
Let's keep going as high as we can. Let's do treatments for 300, please.
In the ACT-2 trial, the confidence intervals crossed 1 in females for their primary outcome of time to clinical improvement in their study of remdesivir and this drug. Any takers on that? Okay.
Heck, I can Google it, but yeah.
I think Ken guessed hydroxychloroquine though, so they should lose points for that.
So this is one of the JAK inhibitors. And this was the New England Journal study, and this was not commented upon anywhere in the paper. So the take-home message from this board is look at data for sex disaggregated analysis, understanding that there are some researchers on the board, and the better way to do this would be to design your study up front, to include enough power in your study that if you found a difference, it could actually be possibly valid. But we have to start somewhere. And the first place to start is not just including males and females, but actually looking at your outcome data by sex disaggregated analysis. Okay, I think it's board of directors.
Go for it, Michelle.
In the news, 200.
In April, Arkansas just became the first state to ban this type of care for minors.
Rams.
What is puberty blocking agents?
Good for you. 17 other states are pending legislation, some with criminal charges against physicians who prescribe this. So we're emergency medicine providers. Why do we care about this? We are not writing for these medications. We are not doing gender affirming surgery. Well, I think if we just unpack this a little bit, for many of us, if we don't have somebody who's trans in our family or in our friend circle, we might not have ever really thought about this before. And at first glance, it might make sense to wait to being an adult before you can do life-altering therapies. But I want you to consider this example. Imagine that a woman gives birth to identical male twins, twin A, twin B. And from a very early age, they have a gender identity that they recognize themselves as being little girls. say mom and dad divorce, mom stays in New England, dad goes down to Arkansas, the kids grow up, they continue to have a very consistent gender identity of being trans women, and they both hit puberty. Mom takes twin A to a gender affirming clinic, and she's a little overwhelmed by the whole process. And the doctor says, hey, this can be overwhelming decisions for everybody. Why don't we put your child on puberty blocking medications and give everybody a pause for 2 or 3 years to make sure that this is something that's going to be the right decision for them. So 2 years later, they go back. Surprise, surprise, the kid's still trans. If you talk to the doctors who do this type of therapy, blocking the puberty developers are usually for everybody else, not necessarily the kid, because they're pretty sure by the time they hit puberty what their gender identity is. So that twin A now goes through puberty with female hormones. All right, you now have twin B. He moves to Arkansas with dad, continued to be a trans woman, recognized by dad as being a trans woman. Dad says, hey, we have to wait till you're 18. Child B goes through puberty as a biological male, turns 18, starts gender affirming hormones immediately. So at 18, both twins are taking the same hormonal replacement therapy. They go to a family reunion at 20. I ask you, do those two twins look the same? Do they have the same voice? Do they have the same height? And the answer is they don't, because when you go through puberty, there's organizational hormones that affect the way your body will be. So twin A will have a different pitch of their voice. Twin B will have bigger bone structure, a more prominent Adam's apple, a deeper voice. They'll be much taller. They might have a size 13 shoe. And if we look at gender dysphoria, it is related to the gap as to how we internally see ourselves and how we present ourselves to the world. And the larger that gap, the greater the risk for gender dysphoria. And why do we care about gender dysphoria? It's associated with greater depression, mental health issues, and suicide. So as emergency medicine physicians, we should care about this issue because it causes predictable human suffering. These are also all the other organizations that are against these laws. If you are a middle-aged physician like I am, this stuff is not stuff that we were ever trained on. So I want to give everybody this really, really great free Stanford CME course that was developed by Mike Gizzandi and some of his friends that helps us learn more about these issues so that we can be better teachers to the next generation of doctors. These are other resources. Okay, we're winding down. Rams, you have the board.
Let's do male or female for 200.
In general, obesity in this sex has a 2 to 3 times greater risk of early death compared to the opposite sex.
Rams.
What is female?
That is incorrect.
Yeah.
I think we're next, so we get what is male.
Oh, you're so smart. SMRT.
So let's talk about COVID and obesity. When you're obese, you switch your RAS system so you're more teeter-tottered over toward the hyperinflammatory state. You also have a risk of other comorbidities. And if you're overweight, when you do get pneumonia, your lung capacity is decreased because you have more weight to move up and down. What about obesity and sex? Testosterone, when it decreases, you have an increased pro-inflammatory state. Your IL-6 is more likely to be turned on. You also, if you're overweight, can produce estradiol in your adipose tissues. And low-dose estradiol can also enhance your pro-inflammatory state. Going back again to that circle, however, there are also social cultural factors associated with obesity. And this is where, again, the social cultural factors of health impact our patients. Board of
Jim, you want to go for it, Jim?
Yeah, we'll do vaccine trivia for 200.
This famous basketball player wrote this New York Times piece. We should let some NBA players jump the vaccine queue.
Board of Directors.
I believe that was Charles Barkley.
Sorry, Michelle.
Oh.
It is a long since retired player who is very tall, if it helps anybody.
Better narrow it down for us, Jeanette. Well, it's not even our turn anymore.
Would anybody else like to take a guess at this? I thought this was like the easiest question, guys. All right. It was Kareem Abdul-Jabbar. And his whole point was, if you want different populations to get vaccinated, you need to find the trusted messengers within those populations. When we think about people who have not been vaccinated at this point, they are not a monolithic group. They have different motivations and they have different barriers that need to be overcome if we want to get them vaccinated. So understanding what message we have to deliver to these different groups and understanding who is the best messenger to deliver that message is going to be important for increased vaccination rates. Just want to give a shout out to this program. It's called the HAIR program, which was founded at University of Maryland, that involves having physicians go out into the community to reach people to engage in their health.
So Jeanette, just for the record, Charles Barkley did also make that statement. It is all over the interwebs.
How far are you behind? Are we to this point? Are you groveling for points, Michelle?
Yes.
I'm not
groveling, but I was correct. I'm just.
The game is very close.
Was he a co-author with Kareem Abdul-Jabbar?
Yeah.
Oh, if he was a co-author, then that's on me.
So that's correct
How about
for the
give
board.
points to both?
I think that, yes.
Or to them, actually. They don't.
I think we should deserve to get points to them. Okay, Michelle, you have the board.
So it's a tie. I'll just say we're tied. Board of Directors and Rams 2,500.
Wait, how much do nerds have? Just for the record.
300.
All right, who's up? This can be Board of Directors.
Sure, treatment's 200.
Oh my God, Ken, this might be your moment to shine. It might be, just saying. Name the drug commonly used in early days of the pandemic that caused this side effect.
Oh, we have to let Ken answer it.
Yeah.
I mean, come on.
It has to be you.
What is hydroxychloroquine?
So anybody who's on YouTube and hasn't been able to see our Zoom chat, Ken has answered hydroxychloroquine for 90% of the questions so far. Good job.
It's either that or ketamine.
Yeah. Historically, 70% of drugs related to QT-associated deaths occur in females. This is believed to differences in potassium responsiveness to testosterone. And as older males decrease their testosterone levels, they are at increased risk for QTC prolongation. By the way, this QTC prolongation in women is theorized to be one of the reasons why females may be more likely to be found in asystole versus VFib-VTAC. So let's look at these early COVID treatments, and let's look at the ones that could actually prolong your QTC. A lot of them. So the take-home message, look at data for sex disaggregated analysis. Ooh, we already did this one. So Ken, your team has the board.
We'll go for genetics 200, please.
In 2009, 96% of genomic-wide association research was done on populations from European descent. By 2016, almost 20% of research included other populations. This change was most attributed to the rapid acceleration of genomic research in this single country.
Rams.
What is China?
You are correct. Nice one, Rams. So we're going to take a delicate moment and talk about the association of race in the genome. I think in medical school, many of us associated Black patients with sickle cell anemia. But if you dig a little deeper, what you really find is sickle cell anemia occurs in climates that are associated with a certain environment and a certain geographical location. And the areas of dark pink and purple here show us locations where sickle cell anemia are actually quite prevalent, which means that somebody, a male from Turkey or a female from India, might also have sickle cell anemia. So we need to really reframe this idea of monolithic race genes. If you look at the H3 Africa program, which is the Genomic Association research program in Africa, they will say within the continent of Africa, there is tremendous continental genetic diversity. So that two dark-skinned individuals, one from Northern Africa and one from Southern Africa, they could have about as much together, much similarity in some of their genetic allele variations as somebody from Denmark and somebody from North Africa, or somebody from Japan and somebody from South Africa. So Black individuals are more vulnerable to COVID in the United States and have greater deaths due to sociocultural health and systemic racism. We know that all of these factors increase the risk of sociocultural impact negatively on health. Environmental exposures, whether you live in a place that has clean water, whether you live in a place that has sidewalks, whether you have a grocery store, whether you have a safe neighborhood, whether you trust access to a doctor, whether your job is an essential worker, or whether you can work from home from Zoom. So just to be clear, we are all healthcare providers, and race is our lane because it negatively impacts health outcomes. Last 5 questions.
In the news for 100?
True or false, the gendered aspect of being a physician during this pandemic has impacted academic medicine?
Rams.
So true.
There's gender differences in who has leadership roles, who has positions of power and did rapid changing, who did more clinical shifts, who had different changes of household responsibilities. And I would like to refer to this wonderful article by our scorekeeper in New England Journal of Medicine Catalyst that provides some of the solutions to this. Recognizing that there are differences, recognizing at this point in time, there may be significant different needs of different members of your faculty. Thinking about what you can do to pause the clock for certain faculty members if they need it due to the circumstances of this pandemic, including COVID canceled events on CVs, looking at the expansions of what is considered an acceptable academic pursuit. By the way, we just lost 2 PAs. They're going to a hospital in Florida that the #1 thing that attracted to that hospital is that they had in-hospital daycare for their babies. Rams.
Genetics for 100.
This long COVID symptom is found exclusively in males and hypothesized to be linked to SARS-CoV-2 induced endothelial dysfunction. Anybody here?
Board of Directors.
All right, my board colleagues, it has to be erectile dysfunction, right? It's exclusively in men.
Oh, that's a good idea. I like that one. Well, I mean, I don't like it, but
I mean, I don't like that one at all.
I like that as an answer.
It's my best guess.
Let's do it.
Nice.
Way to go, Michelle.
Okay, this is not a great study. It's based on an Italian survey that matched it to an Italian survey of patients who had COVID and then matched them to a pre-COVID survey on erectile dysfunction. However, there are a lot of reasons to think that this could affect erectile dysfunction. COVID is a endothelial disease. There's immunothrombosis that can impact flow. It can have cardiac pulmonary complications. And also, people who have erectile dysfunction are probably higher risk of that outcomes at baseline. I can tell you I have no qualms with using this for another tool to encourage vaccine assessment. Board of Directors.
Male or female, 100.
Patients of this sex who were severely ill with COVID-19 appear to be better convalescent serum donors due to their higher antibody titers.
Nerds.
Where's my team? I just want to get 100 points. Got a 50-50 going here. Antibody titers would be higher in women. What is women?
Would somebody else like to take a second choice?
Oh, burn. Can I get some aloe vera for that burn?
I think Rams was next.
It was our turn. We took the fall on one of these, one or the other earlier. Okay.
Great. Guess women then. What is women?
Hello. Are you wearing tie dye? What are men?
Yeah, so the thing is Ken would be right for most things. We think about when people get sick that females in general have a much higher antibody response, but when they look at who appears to have the highest quality antibodies per convalescent serum, it appears to be males who almost died. Interestingly enough, again, I'm going to highlight some research that one of our other judges on YouTube, Dr. Allison McGregor, has recently written about. Who the donor is actually matters in a lot of blood transfusions. And it's something that most of us probably have never thought about before. If you look at TRALI, which is transfusion-related acute lung injury, female donated plasma increases the risk of TRALI 20 times compared to male donated. This is a nice review that by Zimmerman, which Allison McGregor is the other author on. They think this is due to human lupus antibodies, which a third of previously pregnant women have. So even now, if you go onto the FDA EUA thing for convalescent serum, they only will take non-pregnant women or women who have had negative HLA for their convalescent serum. So again, these things, they're off your radar and you think they don't matter, but they could be transformative to certain patients. Last two, winding down. Ken, I think you actually get 2 answers. In fact, you guys, I think we should give Ken the last 2 questions because I think his team abandoned him.
Yeah, pity questions. This sounds right.
Super good sport here, and I just really want to thank you, Ken.
I'm loving every minute of it. I'm so pleased to be socially connected but physically distant from all of you wonderful people. Thank you for contributing to my wellness.
It's better than being physically connected and socially distant. I agree.
Yeah, it's called a 10-foot pole, Ali. I'm just staying away from you. It's that pirate thing. I'm intimidated. Treatments for 100, please.
As many people who suffer from long haul COVID appear to be females in their early 50s, this non-infectious condition is considered in the different.
Rams.
What is menopause?
You are correct. So there's an overlap with menopause and long-haul COVID symptoms, including fatigue, brain fog, sleep disturbances, joint pain. Dr. Louise Newman runs this huge menopause, what sounds like complex in the UK, and she developed an app because it's important if somebody really is just suffering from menopause, many of their symptoms might dramatically improve by going on a hormone replacement. Okay, last one. Vaccine trivia. To increase immunization rates of this vaccine from the 1970s, The blank umbrella campaign was started by the health commissioner of New York. I will give you a hint. It rhymes with umbrella.
Based upon rhyming things, I would go with rubella. Is that okay with you guys?
Umbrella. Yeah, let's do
I
it.
like it. I like
What?
it.
What is rubella?
So this campaign went to children's TV shows.
Nice job, Jim.
To the point that these kids went to their parents and asked to be immunized to save pregnant women from losing their babies. So it was incredibly successful. So we are now going to go to our final Jeopardy question. What are the points for the different teams?
Okay, so we have 3,000 for Rams, 2,700 for the board of directors, and 400 for nerds.
It's hard to be considered a team when there's an N of 1.
But it is a strong one. I think that we need to increase Ken's points because
I think the Metamucil guy had to use the restroom. I know, no bathroom humor, I was told.
Before we go to the final Jeopardy question, I really want to sincerely thank everybody who helped make this game possible. This is really important that as researchers, educators, and clinicians that we consider biological sex and sociocultural factors in our own work. So I so much appreciate everybody showing up and being game for the game. And I hope that we can influence patient care and enhance the way that we optimize our care to both males, females, and non-binary individuals that we take care of in the emergency department. So the final question, are you ready to bet what you're going to bet for the final amount?
Do we know the category?
Sex and gender. It's a it's a turn. It's a right-hand turn. Sex and gender. What is the take-home message of this talk?
Sorry, what are we supposed to be doing right now?
Is this a question?
This is the final question. This is the final Jeopardy question. You have to decide how many points you're going to put up, and then you have to tell me what is the single take-home message of this talk, which was the answer to 2 separate questions.
So they put their wagers in the chat.
Okay.
Jeanette, is that right?
Yeah. So Rams, you go first. Oh.
We have to hear all the bets and before we,
Yes.
Yeah, don't you put the bet? Yeah, put your wagers in the chat, right?
Yes, that's a great idea.
Wendy says we're all in.
We're all in.
3,000 for Rams is the wager. We need one from board of directors and from Ken.
Well, if they're going to go all in, I think we have to go all in too. And you know what? We can pull Ken onto our team and we can all go all in together.
Oh, this is sounding like High School Musical. We're all in this together.
But then we're at 3,100. We're just above.
Actually beat Rams.
Remember, you're ganging up on residents and how that looks.
And I don't think you want me on
Nihal,
the
you
board.
tried to answer for us before, so you're done, man.
Okay, Rams, you're going for the whole shebang. What did you say? What is the take-home message of this talk?
So sex and gender really matter in medicine. And
Yeah,
it should be important.
I'll kind of give you that. But that's a great answer. That's a great, we'll give you half points for that. BOD, do you have a better response to that?
But Wendy wasn't done. She got cut off like ASAP.
Wow.
Go ahead, Wendy. You may finish the rest of your thoughts.
Oh yeah, just gonna add that it's important in clinical decisions, but also research, and that they're, you know, two different things that is very important. And feel free, Taylor and Nihal, if you want to add anything.
It should be included in all clinical decision making.
These are the future doctors of America. I'm feeling good for our emergency medicine patients. Board of directors and Ken. What is your final answer?
It's the same.
Except we're gonna add the word COVID to it.
COVID.
Sex and gender is our lane.
In COVID.
In
And
COVID.
everywhere.
And we need de-aggregated gender data
In COVID.
everywhere.
Oh, bingo! There's confetti falling in our room right now. You just don't see it. It's confetti. So next time you're at a journal club, the next time you're at a grand round and somebody puts up a great study, ask the simple question: has the gender been disaggregated? So thank you very much. Be well, and I can't wait to actually see everybody in flesh and blood in the labs next year. God bless you.
Thank you, Jeanette, for putting together an amazing game.
So I think we're off YouTube. How did that feel? Because it is so clunky without being able to kind of see everybody. Did you feel like you got